Well, good day. Good day, and welcome to Mental Health and You. I'm your host, Cynthia Timms. Well, guys, there's something good and clean happening on the corner of 3rd Avenue and 149th Street. I want to bring you in our guest right away because we got a lot to talk about. Samuel Cabassa. Samuel,
Yes, Cynthia, how you doing?
how you doing?
Um,
I want to bring you in to do a proper introduction. I talked about something good and clean happening on 149th and 149th near 3rd Avenue in the Bronx. You run the Community Shower and Wellness Center. Tell our audience what that's about.
okay, first of all, hello, Cynthia, and all the listeners and viewers, as well as the technical team. My name is Samuel Cabassa. I'm the executive director of Mobile Community Shower and Wellness Services. It's a box trailer with two private showers, stalls. Each one has a toilet, a sink, and a mirror. Is air conditioning and heating. We're on East 149th Street between Brook Avenue and St. Anne's Avenue, right alongside the wall of AutoZone. And what we do is we provide showers, haircuts, new and gently used clothing, toilet services, uh, Narcan distribution. Naloxone is also known as. I do peer counseling. I send people to detox and rehab right from here by networking with Promesa and St. John's of Riverside and other clinics that do detox and outpatient, inpatient and outpatient. And we've been here since the summer. We're averaging about 13 to 16 guests per day. Um, this is a community that's ravaged, by heavy substance use and mental illness, individuals that are homeless, experiencing homelessness, and the marginalized. So we provide free access to showers and the other services that I mentioned, and we're getting a good feedback from the community. There's people that are going shopping or going to work waiting for the bus that have access if they could use the bathroom. And it makes us feel good because it shows that our program is not being stigmatized as a program strictly for people that are homeless or experiencing substance use disorder. Um, there's tons of people that go by every day. They look at the shower trailer, they get the concept, and as they're walking by, they say, God bless you. That's a beautiful thing you're doing for the community. Oh my God, it's amazing. We have high school girls that stop by and want to volunteer. They invited me to speak at their school. Um, I mean, the love we're receiving from the community itself, it's beyond words. Um, One time, my older brother drove the shower trailer to the site, and there was two vehicles in front of them, and they pulled up and where the spot where we parked, and one of the guys from across the street came over and told the guys, "Hey, listen, move your cars. That's for the shower trailer." And the guy said, "Yeah, I'll move it in a minute." They said, "No, you're gonna move it now. Them guys put a shower trailer there for people that need showers. Go find somewhere else to chit chat. So we're getting
Samuel,
a positive
Samuel,
response.
Samuel, let's back up for a moment. Let's back up as I get myself together here. Let's back up for a moment. Why, why this spot, and why was it necessary?
Well, I don't live too far from here, and the reason I chose this spot is because the substance use disorder in this area is probably at its worst. You have individuals that'll kneel down on one knee right in the middle of the sidewalk with pedestrians passing by on their right and their left, and they pull out a hypodermic needle and they just inject drugs right out in the open. Um, so, um, I chose this area because individuals need the services. They need clean clothing. They need food. They need haircuts. There's a high opioid overdose incidence here. And so I just was able to partner with the 40th Precinct with Officer George Lugo, and he selected this location. I viewed it, and I told him it would work very well because it's a location where this is definitely needed.
Okay. I'm still trying to get myself together as far as this picture is concerned. But talk some more. And can we see? Is it possible? Works with you, I should say. You have family. You
My
have.
niece, yeah, I'm gonna turn this around. My niece, let me know if you see her. Can you see
Yeah.
her? That's
Going.
that's my niece Erica, and this is her partner, BB. All right, you see BB? This is
Yes,
the
we see
truck. This
me.
Do you see the truck that we use to haul the shower trailer?
Yes.
Okay, this is my older brother Ralph.
Hello,
Without
Ralph.
him, without him, this wouldn't be possible because he's the driver. I'm gonna take you inside to the shower itself. Can you
Thank
see?
you.
Can
Thank
you see
you.
it?
Yes.
Okay. All right.
Now, what are we
Uh,
looking at? And
all
how
right.
is
You
it? How
look.
do we
Look.
utilize this?
Can you see the mirror?
Yes.
Okay, that's the mirror. Can you see the sink?
Yes.
This is the towel dispenser, hand soap, toilet. Can you see the toilet?
Yes.
Okay, this is toilet tissue. This is the wall where you hang up your towel and your washcloth. And you see the shower head?
Yes.
Okay, what they do is they got to remove this. And then you see this here?
Yes.
You bring it down, and the water comes out. You see the water coming out? Can you
I'm
hear it?
seeing it.
Yep. So that's how they perform the shower. And this is this is the soap dispenser and the shampoo. You see that?
I see.
Okay,
Yes.
you can see how roomy the shower is. Look how much room they have from here to here.
Mhm.
Can you see it?
Wow. I see. Samuel, who has been your clientele? Who's some of the people and what's some of their stories that's come
Um,
through and why?
the people we've been servicing are people right from this community, and
Hmm.
the majority of them are experiencing homelessness. They're living right out here on the street, and they're using opioids uh, and other substances, fentanyl. Um, and like I said, I'm going to show you a corner right here. Can you see this corner here?
Yes, I can see we can see the
Okay.
corner.
All right. This corner here is always littered with garbage. People urinate and defecate right over here. And they use this as a shooting gallery. You know,
Ah.
we put this container here so they could drop the needles in there. If not, this whole place will be littered with needles. Now, that little corner there is always filled with garbage. I mean, mountains of it. So every day that we come, we sweep the area.
Mm-hmm.
Um, and sometimes the sanitation truck comes by and they see what we're doing and they let us throw the garbage in their truck. And so the individuals in this area kind of like gave up on themselves. They lost their pride and they lost their dignity. And they don't care if women and children are walking by. They'll urinate right in front of women, right in front of children. Anybody who's walking by, they don't care. Uh, they're just, used to living the way that they're living without any hope, you know, and they just been through a lot of trauma. For an individual to kneel down on the sidewalk in the open with people walking by on either side
Yeah.
of them and not care and pull out a hypodermic needle and just inject, whatever substance they're injecting, it speaks volumes. So this is why it's so essential to have the services here, because I also do peer counseling. So when they go in the shower and we give them new clothes, they're very grateful because some of them haven't bathed in 2 weeks, a month, and now they're getting used to bathing at least once a week or twice a week, depending how often they come. And they may come on a Monday and walk by on Wednesday, because we're here Monday, Wednesday, and Friday. So they may walk by and they'll say, "Hey, I'm coming back," but they don't, and then they'll come back the following week. But we have individuals that are coming here every Monday, Wednesday, and Friday, and that shows the impact that we're having on their lives, because it shows if they're going through what they're going through in order to take a shower. If they had their own home, if they had their own home, they would be showering every day, you know?
Hmm.
So they're very grateful. I buy all the clothes with my own money. Um, Whenever I'm running low on supplies, I replenish the supplies as it goes. We started receiving donations as far as gently used clothing.
Hmm.
And so, you know, things have been working out beautifully. We've never run out of stuff. We provide them with brand new socks, brand new underwear, a brand new t-shirt, brand new sweatpants, brand new hoodies or zip up sweatshirts, you know, flannel shirts. We've been giving out gently used sneakers and shoes. Um, and, you know, we prepare sandwiches and stuff. And, you know, we give out lots of Narcan. We have one individual that's reversed about 11 overdoses, you know. And, you know, this is a community that is very high in drug trafficking, you know, and there are shootings and stabbings here galore, you know. So we're in a combat zone, and you know, I come from the streets, as you know. I've been on your show before, and
Yes.
we we're comfortable in this community, you know. In your show, your first show last year, I shared that I did 34 years in prison. I came home in 2017. I started working as a peer counselor in Wyckoff Heights Medical Center, the emergency room. Then I transitioned over to Bellevue Hospital in the emergency room as a peer counselor. And now I work for the Department of Health and Mental Hygiene as a wellness advocate. And so I do that at night, 7 p.m. to 7 a.m. And from 10 to 4 p.m., I do the shower services, you know?
Okay. You know, Samuel, I want to talk more about this peer support work and why you feel it's so important and the long-term effect and the long-term impact. Because, you know, you talked about being there Monday, Wednesday, and Friday, but these people need help every day. So
Yep.
we're going to take a break, and then we're on the other side. Let's talk about some of these perhaps long-term solutions,
Okay.
as you see fit, as you see you deem them to be necessary.
Okay.
And so, for Mental Health and You, we're going to be back on the other side with Samuel Cabassa, and we'll be right back. Thank you.
Jason, let's go see your room.
How is it? Is it good?
If you love them enough to do this, surely you'll check NHTSA.gov/the right seat to make sure they're in the right car seat.
Wow, good day. Welcome back to Mental Health and You. I'm your host, Cynthia Timms. We were speaking to Samuel Cabassa. He is the CEO and the operating director of Community Shower and Services, Health Services, uh, a mobile wellness center right there on 149th and Brook near 3rd Avenue. We're going to bring that back. We're going to bring Samuel back and we're going to talk some more. Samuel, thank you. Welcome back.
Thank
Before
you.
we went to break, you was telling us a little bit about your story, what brought you to peer support. But we
Right.
also were discussing, you know, the needs of this community. There's communities
Right.
like this all over the Bronx, all over New York City, in fact.
Right.
So
Yeah.
how do you see your program as an example of what can be done if the effort and the time and the resources are put in?
Well, to answer your question, before you ask, what do I think is a solution, right? In
Yes.
peer counseling, you learn that there are 8 dimensions of wellness. And in the 8 dimensions of wellness, the first one that I believe you should start with is with hygiene, right? How do you expect somebody to make a positive change in their life without being clean? So, in order for someone to buy into a change in their life, you have to be able to help them to feel clean, to feel better, to raise their self esteem, to show them that there's someone there that cares about them, that's going to provide them with the help that they need. And then as you do this, you build a rapport, you build trust. And my peer counseling comes in with being able to discuss with them where do they find themselves a month from now, 2 months from now, a year from now. And, this is just one modality. You have 8 dimensions of health. If you don't have all of them on a par, then you're going to have a weak link in the chain. So a chain is only as strong as its weakest link. The reason a lot of people are out here failing at recovery is because the programs that the government and the state in New York have in place have failed these individuals. You have individuals that have multiple detoxes where the detox programs can care less about them. They're only in it for the money. You have outpatient programs that hire neophytes, K-SACs that don't have any experience, just so they could do billing. This opioid crisis has been compounded by the pay for play. In order to play in this, you got to pay. And so these programs, excuse the word, but they're raping the Medicaid system. There are rules in place about how many times an individual could go to detox. It's supposed to be a 30-day period. And you got these private outpatient and inpatient clinics that are taking individuals 2 and 3 times in a 1-month period, which is illegal. But they'll find a loophole. And they're not concerned about giving genuine care and treatment to these individuals. They're only interested in swiping their Medicaid card. The government pours money into these programs. The money never trickles down into the services. It stays with the CEOs, with the directors, the assistant directors, the operations people. It's all a farce. And I'm telling you, because I worked in 3 emergency departments. I worked in Wyckoff Heights Medical Center, connecting people to inpatient and outpatient detox and rehab. I did it in Bellevue for almost 4 years. And now I'm with the Relay team, which is totally different with the Department of Mental Health, Department of Health and Mental Hygiene. That program works. The wellness advocates there continuously stay connected to their clients. But the thing I see is you gotta start by helping people get clean with soap and water, shampoo, underarm deodorant, a raisin shaving cream, lotion to put on, cologne, and new clothing. Only then can they feel good about themselves and seek to go to the next level, which is towards change. You gotta help them move the needle. But somebody that's smelling with dirty soiled clothing, they're not going to be thinking about change. They're going to be saying, hey, I'm like this. I can't do nothing about it. I'm just going to keep using drugs. I don't care. Nobody else cares.
Wow. Nobody else cares. You said a lot. I know in my journey in peer support and as a counselor, I get that vibe too sometimes, Stan.
Right,
Sam, I get that
right,
vibe too. That sometimes these people, these clients, these human beings, they just want to be treated as human.
right.
It,
And,
so
yeah, and
it's been
and
it's
and what
been
happens
extra. Yes,
and what
they're too
happens is
treated as
everybody treats
clients.
them everybody treats them with stigma. So
Yes,
when they're mistreated at HRA and other places where they're going for help, and people look at them as, you know, using the vulgar terms, as junkies and dope fiends, right? They feel that. And so now, wherever they go, they have that stigma riding on their shoulders. So they don't feel that anybody is there to really help them. And so they're opposed to all of the red tape. They're opposed to all the hurdles they got to jump over in order to receive some kind of resources or services, you know? And when you mistreat someone over and over again, guess what? It's like when there's a dog behind a fence and you get a little boy with a stick that pokes the dog and keeps poking the dog. When that dog gets loose, he's going to want to tear the kid up. And so, please forgive me for using that analogy, but this is what happens to the individuals that I'm talking about. The system rejects them and pokes them and pokes them. And then when they go someplace, they blow up. They finally blow up. And then they want to label them, with severe mental health, give them drugs, put them in observation. And, you have outpatient programs, what you call programs that either prescribe methadone or Suboxone. Those are drug factories. If you go to some of these programs, Cynthia, before you go in, everybody's selling drugs outside. People go in, they tell the doctor any story that they can't sleep, they have anxiety, they're seeing things, and the doctor would prescribe Clonopin, Xanax, any kind of benzos, and they're on methadone, and then they're giving them trazodone, and then they're giving them Remron, and then they're giving them all kinds of other psychotic medications. And what do you think that does to somebody that's using, medication-assisted treatment and then still using drugs in the street?
You feel
So
like sometimes in my work, you're talking about something. You said something. I dare say sometimes I feel in my work I'm on this merry-go-round.
right,
I'm on this merry-go-round because I'm trying to humanize them. We're trying to humanize them, but we work within a system that doesn't humanize them.
exactly. The
Um,
system, the system
yes,
is all about publicity. You get uh, O- you
making
get
money.
Oasis, you get Oasis,
Hmm.
SAMHSA, all of these agencies that they'll put on a good uh, social media. They'll
Yeah.
make public announcements and yeah, we're fighting it and we're doing this and we're doing that. And what they're doing is window dressing because most of the individuals that are seeking treatment know way more than the case acts that are trying to take care of them. And then the case acts have so much pressure put on them to write notes to use it as billing that they cannot connect with their clients. They cannot give
Samuel,
their clients proper treatment.
I hear you. Samuel, you said
Yes.
you're out there Monday, Wednesday, and Friday. Is this all year long?
Wait
How
one
long are
second.
you out there till? Okay.
There's an ambulance going by. Wait one second, please.
We're getting real today, folks, on mental health and you. We're getting real. We're roaring into the street.
Okay, what
Samuel,
was that?
you're here Monday, Wednesday, and Friday as we start to close down. We start to
Yeah.
wrap up. Is this year round?
Is this year?
How long are you operating
Oh,
till?
we're operating the shower trailer till November 9th because in the winter the pipes would freeze and the seal on the bottom of the septic tank would bust. So we're
Hmm.
gonna stop the shower services, but we're gonna give out meals from noon to 1:30 and continue to give out clothing and let them know where they could get shower services. Like on 144th and Park, you have Boom Health. They allow people to shower and stuff. So we're going to encourage the participants to go there, and we'll give them a little bag with, a hygiene kit with clean clothes. We'll feed them and provide Narcan, and we'll continue to build that relationship with them. You know,
And how can others get? I know we have your contact, but how can others, if they wanted to give, if our viewers want to
if
give,
you
how
go
can they
if you
help?
go if you go to the website, there's a donate button. You know, um, and you could be more familiar with the services. The website has that information.
Okay. Samuel, as
Yes.
we start to wrap up, if there's anything that we haven't covered or we have covered and you want to leave with our viewers about your work, about the work that's needed and continues to be needed, what would you want us to know?
Well, what I would want the viewers to know is that, you know, we need to raise awareness through education and have, people learn about opioids and substance use and not stigmatize people. We need people to be more empathic. People are quick to judge, and the individuals that are using substances more than likely have mental illness also, and life is not easy for them. And when people look at them and say, oh, look at them urinating in the corner, defecating, shooting up in the street, don't castigate them. Ask yourself, why would a human being be doing something that is like, immoral, right? Don't be quick to judge. Why don't you ask yourself why and explore that? Educate yourself and see if you could become a volunteer or advocate for these individuals. You
You
know?
know, Samuel, in closing, I always ask myself, and I ask others who maybe don't quite understand, who grows up wanting to be homeless? Who
Right.
grows up coming into this world wanting to be a drug addict? Who comes into
Exactly.
this world wanting to be an alcoholic?
Right.
This is our parents. This is our mother, our sisters.
Right.
One time in lives, it could have been us as well.
It was me
So
at
I
one
want to
time.
thank you. Yes, absolutely. Samuel, as we have to wrap up, and we certainly have to, I want to thank you so much for being part of this experience for mental health and you. And we're going to follow up. We're going to follow up, as the months go by, as we always do. But I don't want to thank you so much for being part of this experience.
Thank
Thank
you
you,
for having
Samuel.
me. Thank you for having me. Thank you for the technical team. And
Thank
to the
you.
viewers, we appreciate the viewers. Thank you, Cynthia.
Thank you. Okay.
Okay. All right.
Be well.
Goodbye. Okay, bye.
Bye bye. Well, you heard it, folks. Who grows up wanting to live and be in these circumstances? But you can help. This is what this program aims to do. I want to thank the Bronxnet staff. I want to thank Samuel and his staff. And I want to thank you. Continue to be part of mental health and you. Peace and light, peace and love. This is Cynthia Timms. Take care.